Good afternoon, everyone. I'm Angie Murat. I'm a patient educator here at the Stephen and Barbara Slaggie Family Cancer Education Center here in Rochester, Minnesota. I'll be moderating today's webinar, and the Mayo Clinic Cancer Center is designated by the National Cancer Institute as a comprehensive cancer center. So we're so glad you're with us today for today's survivorship series webinar number 2, titled Emotions, the Mind-Body Connection, presented today by another one of our patient educators, Terra Register. We want everyone to know who's today on the webinar that we are recording this session so that individuals who are unable to join us for this live session can watch it later. And for those of you who are on the session and would like to maybe review some of the information that we talked about or any of the resources that Terra refers to, with this recording, it takes about 4 business days to get it edited by our media services and then put it onto our video library tab, which is on our Mayo Clinic Connect Cancer Education blog. Just to give you a little bit of information, if you're new to attending any of our webinars, Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect with one another and get evidence-based information and get access to information about the classes that our center offers, as well as webinars. We encourage you to follow our cancer education blog on Mayo Clinic Connect so you can stay up to date on all of our upcoming webinars and all information cancer related education. I'll put the link of Mayo Clinic Connect once Terra gets started in the chat. So just to let you know, I'll be on the lookout for that. So again, we encourage you to follow our blog. Just to give you a little bit of some information on some upcoming webinars that we have. This webinar series, along with others every month, will be the first Wednesday of each month at 1 o'clock Central Standard Time. So we have webinars on the first Wednesday all the way up through December, so December 7th. And you can take a look on all of the different topics that we'll be presenting on survivorship series. And then next week, I wanted to also let all of you know that on August 10th, which is Wednesday, we will be having another webinar on understanding lymphedema, what to know to take control. And that will be presented by a physical therapist at our fatigue clinic here in Rochester. So she has been a physical therapist for many years, and she has a lot of information to share on that. So I wanted to let you know we're going to get started, but if you have questions along the way, please put your questions in the chat and I'll be monitoring that. And at the end of the session, we'll be answering any of those questions. So just wanted to let you know of that. So I am pleased to turn the webinar over to Terra for your presentation. Thank you.
All right. Thank you so much, Angie, for the warm welcome. So this is, like she said, session 2 of the 6 for the survivorship series that we are doing. So in this session in particular, I will cover the emotional side of survivorship and include the mind and body connection. So these series are new, yet we know that these topics are very common when addressing this period of time after treatment. So this series really gives us an opportunity to help address those separate things that are involved with the period of the after and follow-up care when you have finished your treatment for your cancer. So just to let you know that this presentation is really intended for awareness and education. So if you do have any of those concerns, please work with your care team for some of that professional advice. All right. So first, I would like to begin with the definition of cancer survivor. So not everyone who has had cancer uses or identifies with the word survivor. So for some people, this term does not feel right. They may feel more comfortable defining themselves as a person who has had cancer, a person living with cancer, or another way. So the term cancer survivor identifies a community of people with a history of cancer, either at the time of diagnosis during, or after treatment. The effects of cancer do not end when treatment ends. People with cancer or who have had cancer are living longer due to improved care, screening, and newer treatments. It is important to be able to explain and discuss your medical and emotional needs with your healthcare team and loved ones. That's why people should find words that they are comfortable with to name and navigate their personal changes and challenges that have come with their cancer diagnosis and treatment. So in this webinar series, we are using the term cancer survivor to identify someone who has recently completed treatment. It does not mean that information provided in this webinar or our other webinars within the series will not be helpful, but some of the content may be more applicable to those people during this phase of their cancer journey. So the Mayo Clinic Comprehensive Cancer Center is a National Cancer Institute designated 3-site center dedicated to improving the lives of cancer patients and the community. Staff of the Stephen and Barbara Slaggie Family Cancer Education Center, located in Rochester, Minnesota, are committed to providing up-to-date education and resources to empower cancer survivors to be active partners in their health journey and beyond treatment. So as Angie had discussed already, this is the Mayo Clinic Connect. It's our digital platform where patients, family members, caregivers can connect and get evidence-based information and get access to information about some of our classes and webinars that our center offers. We encourage you to follow the cancer education blog on Mayo Clinic Connect so you can stay up to date on those educational opportunities. We will put the link to the Mayo Clinic cancer education blog in the chat. And of course, you don't have to be a Mayo Clinic patient to follow and connect with others. All right, so here is just showing some of the schedule for our survivorship series. So this session is, of course, August 3rd, Emotions, the Mind-Body Connection. So next session will be slated for September 7th, and this will address the tools for wellness, healthy weight and eating habits. And then as you can see there, we also have listed some of the other dates for our other topics that we will be covering. All right, so moving on with our discussion today. So I will cover the following topics to include. So the fear of recurrence, PTSD and cancer, relationships, reconnecting with your partner, and stress relief and establishing that mind-body connection. So the overall hopes of the session will address the following for you to, understand the fear of recurrence is normal and real and how to cope with those feelings, being able to recognize feelings of cancer in relation to a post-traumatic stress response, identify relationships that are important to you and why, identify and use techniques for stress relief and management. And lastly, define stress and identify techniques of mindfulness as an aid for stress reduction to establish a mind-body connection and the road to a better you. So while in treatment, you were doing something to treat your cancer, but now there is this new phase where you are not actively doing something related to cancer treatment. So during this time, it is normal to experience many after effects, including the way you feel, think, and act. So at times, you may have a fluctuation of emotions. This could include examples of extremes of anger, sadness, depression. Just as you feel the need to take care of your body after treatment, you also need to take care of your emotions. Every person's experiences with their cancer is different. So are your feelings and the reaction to all that it is and that has happened. Some people grew up with different values. This could involve hiding your feelings inside, not reaching out to others to utilize the resources available and have no problem talking through their emotions. So there's all those differences on what we're accustomed to. So to address some of the emotional health, you should think about these following things. Recognize your emotions. This is different from, is this different from, what is normal to you? Don't ignore your fears. Communication with your family, friends, or significant others can help you get through some of these emotions. Don't worry alone. Seek help from a friend, family, your support people, or your go-tos. Be well informed of what's going on, what's that plan of care ahead, and speaking with your care team. Make some of those healthier choices, eliminating some of those bad foods or bad habits that you might have. And then talking with your care team about your follow-up care, what to expect, what are your timelines, how can we address some of these emotional things, what kind of resources can they offer. Also reflecting of the past can also help your recovery process. So ask yourself these questions. What strengths have you discovered during your treatment, and how can you use them moving forward? When you feel yourself going to a place of worry, what has helped you relax in the past? Some suggestions to help you could include using a journal to work through difficult emotions, connecting with other survivors for support, finding ways to address strong emotions and process in a healthy way. Consider the help of a professional if needed. Your mental health is just as important as your physical well-being. So working with a mental health professional can help you manage some of these feelings in a manageable way. So just remember that whatever or however you decide to deal with these emotions, finding a healing way that is your personal liking, to include maybe your family, your friends, your support people, or even professional healthcare team, should be what you think is right for you as an individual. So continuing with the fear of reoccurrence. So, when it comes to this phase, it's a point in time where you may have finished your treatment and this period of time that there was just nothing. There was nothing, no treatments, no appointments. Then you have a notification that you'll be following up with your provider for evaluation. Typically, this occurs as a 3-month follow-up timeframe, but may vary depending on your cancer and your well-being through the process. A flood of emotions are often experienced, and you may start to begin to feel anxious or worried. This burden of thoughts of what if kind of pops into your head. You may notice that you're paying a lot of attention to aches and pains in your body. You may feel like a sitting duck of sorts. The doctor says you have no signs of cancer now, but can you be sure? You may be wondering, will it come back? What are the chances it will come back? How will I know if it has come back? What will I do if it comes back? And when will it come back? The fear just kind of grips you, and you have trouble sleeping, being close with your partner, even making some of those simple decisions. But I want to stress that you're not alone. There are many support groups out there with those members experiencing the same emotions. I would encourage you to reach out to them, as they may have an opposite perception, or to help you look at things a little bit differently, or really somebody to, associate with, to really create that bond with someone that might be going through the same thing as you. To speak more on this and how we can deal with uncertainty, that uncertainty feeling, you can learn what you can do for your health now about some of the services available to you. This can help you get a greater sense of control. It helps to accept this rather than fight it. It's normal for these thoughts to enter your mind, but you don't have to keep them there. Some people picture them floating away, others turn them over to a higher power to handle. However, you do it. Letting them go can free you from wasting time and energy and needless worry. So being open and dealing with emotions helps people feel less worried. People have found that when they express strong feelings like fear, they're better at able to let go of these feelings. Thinking and talking about your feelings can be hard, but if you find cancer is taking over your life, it often helps to find a way to express your feelings. If you can find a way to feel peaceful inside yourself, even for a few minutes a day, you can start to recall that peace when other things are happening, when life is busy and confusing. Some people say putting their lives back in order makes them feel less fearful. Being involved in your healthcare, getting back to your normal life, and making changes in your lifestyle are among some of the things you can control. Even setting a daily schedule can give you more power. While no one can control every thought, some say they've resolved to not dwell on the fearful ones. Our minds can potentially lead us down paths when we were already at our lowest. So, leading to irrational thoughts and then leading to other potential factors that we have to learn and adjust our lives to lessen the attention of that burden. So, there are only a few of the suggestions to help you get through this phase of that survivorship and dealing with uncertainty. Post-traumatic stress disorder, or they call it as PTSD, is an anxiety disorder. It may develop after living through a very frightening or life-threatening event, such as a cancer diagnosis and treatment, which these things are a shocking, terrifying, or even a scary event. So we often associate PTSD with war, sexual or physical assault, or a serious accident. Research has shown that post-traumatic stress disorder can also occur with cancer survivors, especially since you're dealing with a life-threatening medical diagnosis. So each person's post-treatment experience is different. For example, some survivors struggle with negative emotional effects of cancer. Others say they have a renewed positive outlook on life because of the cancer. It is normal to have some of these symptoms as a cancer survivor. A study has shown that about 1 in 4 women newly diagnosed with breast cancer experience PTSD. Some aspects that could trigger PTSD in the experience could include the initial diagnosis, pain from the cancer, tests or treatments, test results, long hospital stays, and even the return or recurrence of cancer. However, if you're having some of these disturbing thoughts and feelings for more than a month, if they're severe or if you feel like you're having trouble getting your life back under control, talk to your healthcare provider. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. With successful treatment, you can also feel better about yourself and learn ways to cope if symptoms return. These strategies can help provide skills to cope better with the traumatic event and move beyond it. So, cognitive behavioral therapy. This helps you recognize the thought patterns triggering anxiety and symptoms, recommendations for strategies to help modify these thoughts that are not part of this therapy. Psychotherapy. This may include group discussions or individual counseling to work through symptoms and emotions. It also can be helpful to talk to others who are going through similar experiences. Some counselors specialize in helping people who have had cancer. Therapy can be done one-on-one or in a group setting. There's medications such as antidepressant or anti-anxiety. These can help in managing the PTSD symptoms for on a short-term basis, but it's better to develop a strategy to deal with extreme depression or anxiety with a combination of some of these other interventions I'm talking about. Support groups. They can help with emotional aspects of cancer, sharing in a safe place with other people who have a similar experience that can help alleviate feelings of depression and anxiety and really be there as someone to really share some of those pieces with. Talk with your healthcare team and finding resources for PTSD. Your facility's social work or discharge department may also be able to connect you with counseling services and support groups in your community. So I will have Angie go ahead and post a few of these resources that I have available. It could be contact your local health department, community mental health agency, or family services agency. If your workplace has an employee assistance program, ask if it provides mental health counselor referrals. Ask your health insurance company for a list of local mental health counselors. The National Cancer Institute has many great resources available to you as well. So we'll put that website in the link for you to explore those resources at your convenience. Also located at the Mayo Clinic, the psycho-oncology clinic can help with feelings of depression, stress, and anxiety. You can also request an appointment on our website, and we will post that as well for you. To this point in your cancer journey, relationships have a large portion of support for you. But now that the treatments are finished, what comes next in those relationships during survivorship? Having those essential conversations about your relationship with your significant other can help provide more connection to how you're feeling physically, emotionally, and psychologically. You can schedule a time with your loved one for this conversation, which can be difficult, but it is necessary to maintain or regain some of those intimate conversations that you once had. Here are a few tips here to help you along the way. So consider the slide on, building that relationship if you need that extra push on where to start these conversations. You can talk with them, about your sexual and intimacy changes, managing some symptoms or side effects that can improve, your physical or psychological potential, and initiate some and enjoy some intimate moments. Open line of communication is the first step to moving into more of the serious and essentials of that relationship, especially when talking about your sexual or intimacy issues. So what is intimacy? This is not one of definition, but in fact, it can include 1, 2, 3, or all of these words here on the screen. So there's the behavioral intimacy, is really having the shared activities that we do day to day. Emotional intimacy is sharing those most personal thoughts and feelings with the people you are close to. The physical intimacy, it could be gentle in that physical closeness. And spiritual intimacy, connection that is greater than yourself, satisfied with life and who you are, who you want to be, and where you want to be. So evolving those relationships, it can include some love, affection, and intimacy. They all play a role in healthy relationships. All of various cancer treatments, either single or a combination of those methods, can all cause some, sexual side effects. Time for healing afterward is really essential. Sexual dysfunction is most common with cancers in the reproductive system, endocrine system, and breast, as well as cancer of the organs located near some of those reproductive systems, such as the prostate, bladder, or colorectal. Sexual desire may also be altered due to fear, anxiety, financial pressure, body image, and pressure to be sexually intimate. You may discover that intimacy means something different, including hugging, touching, holding, cuddling. Some of these become more important, while sexual intercourse may become less important. Be open and communicate with your partner. Be honest with your feelings, concerns, and needs. If you are open with how you are feeling, you can work together to address what is best for you as a couple. Plan time for that intimacy. Consider the best time of day. Plan a date. Build in slowly, taking the pressure off both of you, and learn to be comfortable with each other again. If these suggestions are difficult to manage on your own, you can consider reaching out to some of these resources I have that can help you get those conversations started. So consider maybe some consults with couples counseling, a sex therapist. There's also a women's sexual health clinic. The menopause and women's sexual health clinic team provides personalized specialty care for women with a mission to inspire hope, relieve suffering, and advance the science of women's health. They can also assist with sexual health, low libido, problems with arousal or painful intercourse, or other issues with sexual intimacy. Cancer survivorship, natural or treatment-related menopause, hot flashes, night sweats, questions about hormone therapy or non-hormonal treatment options, and other concerns about sexual health or body image. We will include a resource to explore that if that is something that you would be interested in as well. Stress is natural, so normal part of our daily lives. So frequently we think of stress as being an event, but really the event is a stressor, or stress is our reaction to it. Our lives are filled with stressors. Sometimes they are daily events, but there are also those occasional situations that trigger a stress response. So in general, stress is highly individualized, so it's all personal to you and I. What causes stress in one person may not cause it in another. Some people actually thrive under stress, while others maybe struggle to manage the effects of the stress. So stress can also result from life events that are beyond our control, or they can be a result of one's attitude toward daily frustrations. Stress is physical and emotional response to a particular situation or what's going on around us. Stress can be short-term, which is acute, or long-term, which is chronic. Acute stress is a reaction to an immediate, often unexpected situation, for example, a surprise or a threat. Chronic stress involves situations that are ongoing, such as relationship problems, workplace pressures, financial or health worries. Stress can also be caused by technology that is intended to make life easier. Techno stress is caused by cell phones, laptop, or palm-sized computers, email, voicemail, pagers, all of us, which will allow us to be available at virtually any time. Here are only a few of the minor symptoms that one can show as a symptom or a signal of a stress response. So think about it. If these are any of the symptoms or signs that maybe you have experienced at one time and point when you've had stress, you can add to this list, but it could be something small or large. It's good to take note what some of those feelings are when it comes to facing stress and your reactions to it. This is the first step to really understanding how to manage and control stress when it does occur. So keep a log if you've noticed that you are experiencing some stress. What are some of the symptoms you're having? It could be physical symptoms like indigestion, racing heart, headache, thoughts, feelings, could be the anger or sadness, or behaviors like increased complaining or overeating, or maybe not getting up and moving as much as you should. So how do we manage, the stress? So many people fall into the habit of making those unhealthy choices when faced with stress. So how do you respond to a stressor is your choice. With planning and practice, you can control your responses to stressful situations. There are three basic ways you can approach a stressor. You can change your environment, you can change how you react, or you can change both. Even if changing your environment is unlikely, you can reduce your stress by learning how to cope more effectively. You can start small. Changing your response to even one or two main stressors can have a positive impact on your overall stress level. For example, in your environment, there are those things you can alter, eliminate, or give pieces to someone else. So offload some of that stress. The worry time concept is take a few minutes early in the day to outline everything that is bugging you, worrying or concerning you. Is there any solution to do to help? There are times on this list that you cannot change, items, excuse me, that you cannot change, but take the time to really explore and process some of those difficult emotions. So experts agree that a combination of a healthy lifestyle habit and stress management strategies can really significantly reduce stress levels. There are some other resources there available to you as well on the American Cancer Society website, which we will also include as a resource for you as well. Even, managing stress from cancer, it's a cancer support community. These pieces and these people can really help with if you need that extra help in, managing stress and trying to evaluate those pieces that you think that might help you. Relaxation and mindfulness techniques. So another valuable stress management technique is learning to live in the moment, to be fully engaged in the here and now in a relaxed state. Our brains are wired to be problem solvers and want to keep going back to thoughts of those areas that we see as problems. But sometimes we are very limited in being able to solve a problem in the here and now, and we'll need time to live into the answer. So in the meantime, it can feel like your brain is a little hamster running on a wheel, focusing on the problem, but not really getting you any closer to a solution. Have you ever, woken, up over in the night and recognized that you're thinking about an unsolvable problem? That's a question to answer. And many of us do experience this. Mindfulness is a wonderful practice that might be valuable to you during times when your brain just doesn't want to shut off. Our brain is not able to think about two things simultaneously. Even though we can switch from one thought to the next in a split second. So when we focus or force ourselves to think about something positive or routine, we are not able to go into our default mode, which is to think about some of those things that are new or frightening, like a new serious diagnosis. Being mindful is one of many techniques that with practice can actually drop our stress hormones. One of the ways that we can practice mindful relaxation is with relaxed deep breathing exercises. What could be more familiar and possibly boring than the rhythm of our breath, right? So sometimes people will say, I've tried that. It just doesn't work for me. But it's a skill, just like anything else. And as with all skills, it takes practice to be able to feel like we are comfortable doing it. Just the next couple of minutes, just think about how you can incorporate some of the mindfulness techniques and doing those deep, relaxing breathing exercises. If there's a certain time of day that you think would be the best time to perform these. Usually they say it's before bed. Then this way it gives you that time to clear your mind, to be able to lead into a restful night's sleep, to push away all the stress, the anxiety, all the other things that you have going on during that time period before you want to relax. The American Cancer Society has wonderful resources on how to practice mindfulness with some relaxation techniques. There's also a short video that teaches you on focused breathing, progressive muscle relaxation, and even focused meditation. I will have also, Angie, link in to the in the chat, and also it will be on our Connect site with the video on practice mindfulness and relaxation and cancer relaxation techniques. Emotional support can be a powerful tool for both cancer survivors and their families. Talking with others who are in situations like yours can help ease some of that loneliness feeling. You can also get useful ideas from others that might help you. There are many kinds of support programs, including individual or group counseling and support groups. So support in any form allows you to express those feelings and develop coping skills. Studies have found that when people who take part in support groups have an improved quality of life, including better sleep and a better appetite. The cancer experience has had its challenges in more ways than one can be described in one easy swoop. So during this period of after treatment or survivorship, you try to look for that silver lining. This experience may have helped you to develop or enhance strategies, including managing those emotional challenges, deepening relationships with friends and family, realizing your strengths you always had to get through these difficult situations. Surviving cancer may also lead to reevaluating your priorities or your appreciation for life more fully. All right. So at this point, I will go ahead and we'll take questions and answers.
Thank you, Tara. That was wonderful. You're so relaxing at the end, your voice. So very good. So just wanted to let you know on some of the um, links, they didn't go through, but rest assured, I will be putting everything on Connect. But I did put in the chat the links from the American Cancer Society that I could get and put those in there. So just want to let everyone know that will be on Connect. So if you follow, you'll find all that information. So. Okay, now on to questions. So please, for those of you who have questions, please put them in the chat. That'd be great. And we can answer those questions. So we do have a question here. So one particular person's feeling low and wants to reach out to a support group, but they want to know, how do they know that it will be not draining instead of helpful? So I don't know if you want to answer that. I have a few thoughts, but you can go ahead and get started, Tara.
Certainly, certainly. So, that's kind of the feeling I think that everyone has, is, how do I know if a support group is right for me? Is it really going to help? Am I just going to seem more mentally drained or physically drained, attending some of these sessions? But really is just being able to open up and have some of the using the listening techniques, because this is exactly how others want to perceive it as well. So if you want to go to a support group, certainly it's you could always talk with the leader who is facilitating the support group, express your concerns with them, really get some insight into maybe how they proceed with, starting those conversations, how, what they can do to help kind of alleviate some of those pieces for you as well.
Oh, that's good. Yeah, the only thing that I was thinking of adding too was, I think it's okay as well if one group maybe you don't connect with a group, that's perfectly fine. I think reaching out to a local, I don't know, I'm trying to think if you have a hospital or a healthcare facility, like reaching out to them to find out about different support groups. And it's okay to attend, see how if it's a good fit or not. Social workers are a great resource too with hospitals or facilities to see if because they have all the at their fingertips, a lot of those resources available. Here at our Cancer Education Center, we have patient navigators. So they are a great resource on finding out about support groups as well. So just want to mention that. And it's okay to think one group may not work for you and try another group. That's perfectly fine, because just sometimes the dynamic, it might, like you said, it might be either too, like too negative. So where you might want it to be a little bit more positive. So it might just be personalities too within the group. So it might just take time to find the one that's going to connect with you. So sometimes too, I'm thinking of another group like Immerman Angels. That's more with people as they're going through the cancer journey, like their treatment, but two, if you're struggling with like lingering side effects, and I can put Immerman Angels too in the resources. If you put, so they're a group to help match people, and they have mentors that can work with people who have been in a similar situation with their cancer diagnosis. I'm thinking too, that might be another resource to also connect with someone too. Yeah.
Yes. And just a comment as well is, sometimes people are just not for support groups. Maybe that group setting is really not for you. Maybe you would prefer more of a one-to-one session, like Angie had mentioned, is, maybe you can connect with a social worker that maybe they could just really be there to have an open ear, to listen, to maybe potentially offer some advice or other resources to help you along the way. So just know that there's options out there. It doesn't always have to be a group setting. There's that possibility of getting that one-to-one attention as well.
Someone in the group too had, who's attending the session, wanted to know about the link for the sign up for the session for lymphedema next week. I will put that at the chat, but also want to let you know too, if you follow our cancer education blog on Mayo Clinic Connect, if you go to our classes resources tab, all of the links for all of our webinars are on there too. So you can certainly sign up for that as well. So I will put that in the chat. Yeah.
Great. Thank you.
I don't see any other questions or anything else. I'm just wondering too, Tara, if you had any other things you wanted to touch on or anything else. Otherwise we can.
Really, I mean, it's this period of time. I mean, emotions are, all over the place during this, during that survivorship period. And it's normal to have all of these fluctuations and those emotions and how you, maybe even just get to know other people or really starting up some of those friendships as well. It's, it might be a little bit awkward at first, kind of having to move forward, but if you can really just express those feelings right away, just tell them, I'm over this, but this is how I'm feeling. And then you can proceed from there. Just trying to build up that relationship again and being able to move forward and really building it up and enjoying each other again. It's really essential. And as for, let's see, you received an email this week for the series. Is there a way to be able to view the first session in the series from July? Yes, of course. So with every single series or webinar that we do on Mayo Clinic Connect, we do record these sessions. And usually a few days afterward, it's about 4 business days. So after the recording of the live day, we will be able to post those on our Connect site under the video library.
Yeah, perfect. I was just going to say the video library tab. Yeah. So
Yes.
there's like tabs across the top, and under the more tab, and it has like a list of different links. So video library is one. We have a survivorship link that gives you some additional resources on that too. So yeah, and then our classes resources tab is up at the top, and that's where you can register for webinars as well as the lymphedema one. But I did put the link to that lymphedema webinar too in the chat as well. So thank you for talking while I quickly put that in there too. So
Oh, of course. Yes.
yeah, good. Well, good. I don't see any other questions. So we just thank you all today for joining us. Check back, like Tara had said, in about 4 business days. That just gives us time to send the video recording to media services, and then we put it up on Connect. So we hope you join us though for future survivorship series as well as other webinars. Okay, and ask us any questions. We'd be happy to answer too. So any cancer related questions you have. Thank you.